Hey everybody, welcome back. It's Dr. Matthew Hertert here again with Centre Chiropractic in Boalsburg, Pennsylvania, just outside State College and Penn State University. And today I want to talk to you a few minutes about scoliosis and how chiropractic can assist with scoliosis, or why it can be a potentially essential intervention to work with scoliosis to try and minimize the side effects or development of it through the teen years. And I want to introduce and thank my friend Mandy Sargent to be fully forthcoming. She's one of my best friends around, so you have to take my recommendation, my referral to her here with a bit of a grain of salt. She's a fantastic yoga instructor. She has a very healing, loving, and nurturing presence. I know that I am greedy for lunch times with her because I always feel uplifted and enlightened afterwards just by her way of being and her kindness and lovingness. Anecdotally, but I think objectively and significantly, she has about the fastest growing practice that I've ever witnessed out of any kind of healthcare practitioner that I've been privy to in my lifetime. So I think it really speaks to her ability to be of service and help people heal on the mental, emotional, and physical level. So thanks to Mandy for letting you guys look at her x-rays and letting her be seen on camera here so we can talk about this important subject. So most of what we're going to do today really involves in looking at her x-rays here. Scoliosis, that word literally just means abnormal side-to-side curvature. Okay, so it just means that you're not perfectly straight like you'd see in a Halloween skeleton or in a textbook or something like that. And I have, in my practice clinically, I would say that upwards of 75–80% of people have some amount of abnormal side-to-side curvature, usually a pretty slight amount. But a lot of people, I think, hear this word scoliosis and it's got this negative, ugly connotation. You only ever hear about it when it's a really painful or dramatic health condition for somebody, when they might be needing surgery or something along those lines, right? So I think it's important on the placebo, nocebo, mental, emotional level of health. It's important to be aware that you're not letting yourself be implanted by the culture or by what you're reading online or by your healthcare practitioner to think that you're broken or that you're bound to be in pain for the rest of your life if you've been told you have a scoliosis. I see lots of people, I mean, granted, Mandy, you know, she's a yoga instructor, so she spends all day, every day stretching and strengthening professionally, but she is asymptomatic like 90% of the time. She really is very comfortable most of the time. And as you can see, she's got pretty dramatic scoliosis here. By the same token, I've got clients who've got chronic low back pain, and they've got a pretty straight, if not entirely straight, spine in here. So don't let yourself get this idea that there's something horribly wrong with you or that you're bound to have horrible health problems just because you've been told you've got this curvature. At the same time, it's important to try and find the cause if we can and to try and fix that. This does add a lot of stress, not only to the ligaments and the muscles, but to the bones themselves. With this kind of curvature over time, bones will remodel. They'll start to change shape in reaction to stress. And obviously it adds a lot of stress to the nervous system in here too. So you do want to try and see if you can find the cause and fix that. You know, the ligamentous creep, which is a technical term that relates to that constant daily stress put on the ligaments and how they'll loosen and slacken up. They'll creep over time, which makes it harder for your body to keep the joints in healthy alignment. You know, in the literature, if you look into biomechanics textbooks that talk in depth about scoliosis, you'll also see that a lot of studies have found that people have visceral complaints that are directly related to the scoliosis. They don't so much in the literature relate it to the nerve compression idea, but they definitely talk about the mechanical stress. You can imagine with a curve like this, you might have more mechanical pressure or abnormal muscle tension on some of the muscle tension, exactly, but soft tissue tension on the viscera, the heart, the lungs. Very strong correlation in the literature between people having cardiovascular and cardiopulmonary problems who are in possession or happen to have strong scoliosis here. So that stuff is present, but that's not necessarily a hard and fast rule. There was a medical doctor in Philadelphia last century who dissected a couple hundred, the study's actually on my website, a couple hundred animal and human cadavers, and he actually found a 97% correlation between end organs that were diseased or pathologic or not in proper physiologic anatomic function and abnormal curves of the spine where there appeared to be nerve pressure there. So there's definitely a correlation, and just like any spine, it's important to pay attention. If you've got a curve, it's a little bit more important to make that a regular part of your self-care modality, whether it's with an osteopath or a chiropractor, you know, however you undertake that. So there are about 24 causes that have been identified over the years for scoliosis. One of the nice things you'll see in the literature is that 80% or more, at least thereabouts, cannot be attributed to one cause alone, implying that there are multiple things that are causing that scoliosis. And the good news, the bad news about that is it can make it a little harder to figure out what's going on if you can figure out what's going on. The good news about that is it increases the number of treatment options available to you. If there are more causes, there are more things you can try and do to approach that abnormal curvature. There are two general subcategories, though, that are important to understand as a layperson that can help you decide how to work with this or relate to this. And if you've been diagnosed with a scoliosis, you've probably, hopefully, been told about this. One is called a structural scoliosis. The other is called a functional scoliosis. And that's exactly what it sounds like. One has to do with the shape of the parts that you have. The other has to do with what parts are doing. Okay, so structural versus functional. So examples of structural would be scoliosis resulting from poliomyelitis or from a hemivertebra, which is a medical speak for when you're born without part of the vertebra. So as you mature and it develops, you end up with a wedge-shaped one instead of a full rectangular one. You can imagine how having a wedge down here would shape your spine in a certain way. The functional area really relates to things like muscle imbalances, a muscle spasm that's pulling the spine to one side, or even a leg length difference, which is structural in terms of what's going on down here, but becomes functional when your body is compensating for that. In practice, the most common cause that I see has to do with a leg length difference, or at least that's the area to look to get the most value out of treatment through chiropractic. So I want to talk to you about that just for a couple minutes, because I don't think that that's an obvious dot to connect for a lot of people. Most people I've seen in practice have a little bit of a leg length difference. Okay, it's very uncommon to finish puberty with perfectly equal leg length. Some people finish with a little bit more. So you can imagine if your legs are a slightly different length, you're going to kind of be tilted off to one side here, right? So because most of your brain's most important functions are based on your eyes being parallel to the horizon line, like your inner ear gauges balance that way, your cerebellum gauges fine motor control that way in terms of being able to pick things up or not walk into walls, that sort of thing. Since that's a really basic function that's important to all function, your body's going to say, well, gee, we've got the short leg over here, so we're tilted with a relationship to the horizon line. So what's more important to us on a survival basis? Muscle imbalance, low back pain, scoliosis, early arthritis, or being able to walk, balance, pick things up, get food into our mouth, running away from things that are trying to eat us, right? So it's going to go for the survival mode there, and it's going to create a curve in the spine to get your eyes level to the horizon line again. And most often, I think this is interesting in terms of relating to the intelligence of the body, most often you'll see three curves, okay, instead of one big curve. If you think about that, if you have one big curve right in the middle doing all that compensation, there'd be a tremendous amount of stress, degenerative stress on that one area. So the body tries to spread the stress of that correction across as many vertebrae as possible. So you don't have one or two right in the middle that are getting nailed. So the intervention that is available for this, at least with some doctors of chiropractic, particularly Gonstead technique, is looking at whether a heel lift would be of value to you. So it's a little rubber shim that you wear in the shoe on the side of the short leg. And what that does is it boosts up your legs at femur level, right through here, so that your body from there up has a fighting chance of really taking a normal or a normalized shape. Now, we're very cautious with this in clients who are over 30, 35 years of age. At that point, your body's already been dealing with this for at least 10 years. And there are a lot of chiropractors, I think, who just give a heel lift to everybody who comes in who has a leg length difference. And I don't mean to be cynical about this, but I assume that's either commercial, they just want to sell a $15 heel lift to everybody, or it's just poor education in terms of the potential and the potential ramifications with this. As a teenager, it's incredibly important to shim the short leg, and I'll talk to you about that in a minute. I'm going to put up another set of films here. We're going to look at a young girl who just started, a 14-year-old who just started care in here, who was sent here by the school district because of an abnormal spinal curve. So the last thing I want to say really about this, it relates to the experience you're having with your osteopath or your chiropractor in terms of getting adjusted. As a layperson, there are two things to know about this that can help you take better care of yourself. And as I've said in the other videos, I do not ever support or encourage anybody in being belligerent, aggressive, smart alecky with their healthcare provider. At the same time, you have to be self-advocating. Nobody can ever care about your health the way you do. So two things you can pay attention to and ask questions about if they seem different are that you should always be being adjusted from the convex side of your curve, not from the concave side. So for those of you who don't remember high school geometry, the concave side is the dip in, and the convex is the side that's sticking or bulging out. So you can, I mean, I'm sure this makes a lot of sense. If you're being adjusted from the concave side, regardless of how precise and effective your adjustments are, you're going to tend to worsen that curve because you're pushing out on an area that's already stuck out. So there are very, 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 very few exceptions to this, although there are a few. So that's one thing you can pay attention to, is making sure your chiropractor is contacting you or standing on the side of this convexity, standing on the side that sticks out. The other thing to pay attention to is if your chiropractor is somebody who makes adjustments using 2 hands instead of 1, with a curve like this, you should either be getting adjusted with 1 hand, or you should notice that with both hands on you, when that little thrust is delivered to set the vertebra down, only 1 hand should be pushing. The other one is just stabilizing the vertebra to keep it from rotating or moving in that direction. There's only a thrust being given from one side. This young lady was actually referred here by the school district through her parents after a screening exam there, found that she looked to have a structural versus a functional scoliosis. And we took these x-rays last week with her, and I wanted to put them up before I marked them so there aren't all those lines and other stuff kind of obscuring or obfuscating what's going on here, so you can see a little bit more clearly. But if you look, and I'm not really sure obviously how clear this is going to be, but if you look at this, I'll give you a close-up here in a sec. Her right leg, we're looking at her back here, so this is the right side, this is the left side, just like you're seeing on your screen. Her right leg is a good, probably almost 3 centimeters shorter than her left leg in this case. You can see it by the grid lines here. And then what you'll see is she's got a marked curve to the right, and then it dips back to the left a little bit. She's straight for a little while, then she leans off to the right again, then right at the top she's got a very sharp correction back to the left. So this is not only stressing this area, she's got compensations for this that are going on up here that can cause nerve pressure, muscle imbalance, dysfunction, things of those sort, can affect hormone production, all that sort of stuff. So what's important to understand about pediatrics or teens, and it's really why I'm spending time going through this, is that it's a very different circumstance than it is for adults. This young lady is still developing. She's 14 years old. These bones are not completely grown yet. Her growth plates are still open. The bones are to a degree still cartilaginous, meaning like your nose or your ear, they're kind of soft. So if she's walking around with this shape in here, crushing or pinching or with pressure on the outside of that vertebra that's cartilaginous, it can lead to a wedge-shaped vertebra in here that she exits puberty with. And if the body has corrected the leg length difference down here, that's a real bummer, because now she's stuck with that shape. It's set in bone, no pun intended. But what happens for most of us through puberty is the legs they're not growing at the same rate all the time. All right. What happens in some people is one leg gets ahead of the other, so now they're doing this. For some people, that short leg will catch up, or more or less catch up at the end of puberty. So instead of a 20 millimeter leg length difference, you end up with a 4 millimeter leg length difference. But if this hasn't been attended to try and reduce this curve, then you're probably going to have something of a wedge-shaped vertebra stuck now here. And even though your legs have equalized, you can't hold a more normal, healthy, straight shape in the spine there. So the process really is to use those heel lifts that I talked about before and to shim the short leg so that the body has a chance from here up of holding a normal shape so stuff doesn't get structurally ingrained here for the rest of her life. Now, I don't know of any other healthcare practitioners who do this kind of analysis or this work. And in all honesty, I don't know chiropractors who do this outside of Gonstead practitioners. So I'll put up the referral information here, but if you want, you can always contact me. I can try and help you find a Gonstead doc in your area. I'm sure any chiropractor would be able to help. I think that the way that we approach this in our technique is sort of the cat's meow with this. It really gets you the optimum value out of this process. There are a couple different kinds of scoliosis, which are not that important, but I think important to at least mention. Infantile scoliosis, which really is birth through 3 years. In the research, we tend to see that that really doesn't progress as a kid ages. If you get into juvenile scoliosis, which is 3 to 10, that does tend to progress. So if you notice that with your kid, if a school screening catches it, it's a really good thing to pay attention to. Even if the school screening catches it, but they say, oh, it seems functional, not structural, why would you want your kid walking around with a functional scoliosis while they're developing? It's always an important thing to pay attention to so you can really have full health, maximize that for the rest of your life. So if you guys have any questions, please feel free to post them below this, or you can always email me or call me on my lunch break or something for a free, no-cost, no-obligation consultation. You can wander around the website, check out the free blog, or sign up for the free email newsletter. You can call our awesome staff at 466-2000 to set up your first appointment. Thanks again to Mandy for her time today, and I hope this was valuable and informative for you. Thanks for your time, and blessings to you and yours.